Let's start by looking at the world of egg donation, how it works, why people choose to do it, and the ethical considerations that surround it. I've got Professor Nick Macklon, who's the medical director for the London Women's Clinic. Nick, hello.
Good morning.
And we've got Professor Nikki Hudson, who's a medical sociologist and director of de Montfort Centre for Reproduction Research. Nikki, hello.
Morning.
Morning. Nick, can you just talk us through the actual process of donation? What does it involve, egg donation?
Yes, well, the women who decide that they wish to help other women in this very special way will tend to contact the clinic themselves initially to make an inquiry. And once it's been discerned that they would potentially make suitable donors, then they would undergo conversations, counselling, and discussions with doctors, and a number of tests to make sure that they would be okay to donate. And only a small proportion of those who make that initial inquiry will actually proceed to donate, because there might be some reason why it wouldn't be appropriate for them to do that. Now, when they reach the stage when they're ready to donate, they will need to think about 12 days of undergoing injections with a hormone which they make themselves, but we deliver in a slightly higher dose using a little pen. They can do that once a day for about 12 days. And during that period, we'll do 2 or 3 ultrasound scans to monitor how they're responding. And there'll come a point where we will see that the follicles in the ovary that contain the maturing eggs responding to the hormones will be ready to be harvested. And at that point, the donor will be invited to come into the clinic. They will have sedation from an anaesthetist usually, and then undergo a procedure that takes about 15 minutes, whereby the fluid from these follicles, which have grown in the ovary over the last 2 weeks, is removed. And with that fluid, we hope, comes the eggs. Those eggs are then taken to the lab and then assessed for quality, and if they're appropriate to freeze. In most cases, that's what we'll do. We'll freeze the eggs and store them. They will then stay for around about an hour or two afterwards to make sure that they're fine and they're recovered, and then they can get home. And then they'll be contacted regularly over the coming week, really up to 3 weeks, where they'll have a follow-up to make sure everything's fine. Most of this treatment can be done continuing with work. There's just one day, perhaps, where we ask our donors to take a day off, and that's the day when we remove the eggs.
Okay, great. Nikki, how does egg donation in the UK, how does the process compare with the rest of the world?
Yeah, in the UK, we have really great regulation for fertility treatment. So, and donors really appreciate that, as well as patients. So we have the Human Fertilisation and Embryology Authority in the UK, which regulates treatment, and it licenses clinics. And that differs from other places where there is less independent oversight of fertility treatment. So the United States, for example. So we have very specific rules around egg donation in the UK. Donors can't be paid, but they can be compensated £750. They have to agree to be identifiable to anybody who's conceived from their donation when that person reaches 18. There are guidelines for clinics around offering donors support and counselling, for example. So we have a really well-regulated system in the UK. That's not to say that things couldn't be improved in places, and some of the research that we've done has shown that there could be improvements in the way donors are treated in clinics. But on the whole, I think the UK is often held up by other countries as a good example of how to regulate egg donation, fertility treatment in general.
Let's bring in Neve. Now, Neve is a veterinary student who has donated eggs twice. Neve, good morning.
Hello, good morning.
Hello. Tell me why you donated, when you donated, and what kind of motivated you?
So I first donated in 2018, and it was literally just replying to a radio advert I heard at the time, where I lived, that was seeking egg donors at a local clinic. And I literally thought, I'm young, I'm not using my eggs.
How old were you, if you don't mind me asking?
I would have been around 20, but
Okay.
I would have been a bit younger when the process started. It was quite a long process. So I was around 20 when I donated the first time. And it was genuinely just to sort of try and help someone that needed the help. And then obviously went through the process, had that experience and then decided to donate a second time.
What was that first experience like? What did it, I mean, physically, how did it affect you emotionally, mentally? What care did you have?
It was challenging. It was obviously a very long process. A lot of sort of trying to understand how this could affect me in the future, and how it affects me now. My body sort of went through a lot of changes because of the hormones that I was having to take and things like that. The actual retrieval was fine, but I did develop a bladder infection post retrieval, so my recovery was a bit slower than others. And then my care from that clinic I didn't think was great. So I decided to not go back to them, but I did really want to donate again to a different family. So I went to a different clinic a couple of years later and donated with them as well.
And were these families you knew, or
no, it was completely anonymous?
Okay.
Until I turned, until the prospective children turn 18. But I didn't know anything about the first person I donated to. The second time I donated, I was given some information about them, but nothing identifying, just sort of telling me, why they needed an egg donor. It was a lot more emotional the second time around, but whereas the first time I literally knew nothing about them.
Now, it's illegal to pay for egg donation in the UK, although egg donors can receive compensation of up to £750 per donation cycle to cover costs. Were you paid, Neve? Were you given compensation? Let me phrase that correctly.
Yeah, so I was given the compensation both times. First time, the £750. I did have to chase the clinic for it. It wasn't quite as easy as just sort of walking in and walking out with £750 in your pocket. And then the second time, it involved a lot of travel. So they took that cost out of that compensation. So I actually got a lesser sort of lump sum at the end.
Was that a motivation for you, the money?
I would probably say the first time, probably a little bit.
Mm-hmm.
But then the second time, knowing exactly what I was getting myself into, it wasn't a motivation at all. I walked away with less compensation and a lot more maybe emotional sort of not damage, but it was during the COVID pandemic, so it was a lot more going on and a lot more to contend with. So I would say the second time round, it wasn't motivational at all.
Nikki, shall we talk about this compensation? Some people might hear it as, and Neve's explained her motivations very clearly, I think, but some people may think, when there are adverts kind of saying that you can be compensated by a significant amount, £750 plus costs, does it in effect work as an inducement?
It can do, I think, for some women. We did a study across 3 countries in Europe, including the UK, and it varied across those countries. The other countries were Belgium and Spain. In the UK, the women that we spoke to, it tended not to be a primary motivation. Just as Neve's outlined, actually, what often happens is that people come into the process with one set of ideas and motivations around what they're doing, and then that changes. So sometimes it might be the money seems quite appealing, and then they learn more about the process and so go on to donate again for kind of other reasons. Or it might be they do it the first time because they think it's a great thing to do, didn't actually know about £750, and then next time the £750 can come into play because of additional costs, as Neve's outlined. So I think it's an important consideration that often is held up as being problematic, but it's much more complex than that in terms of how it plays into people's decisions about whether to do it or not. And I think most women that we spoke to in the UK, were motivated by the idea, often responding to adverts actually put out by clinics, to the idea that they were helping somebody to have a family, and the compensation was a nice to have, an added extra. So it wasn't a huge motivation. I think on that though, I think what is interesting and what may have happened since the change, so the increase in compensation to £750 happened around 10 or so years ago. I think that may have changed clinics' behaviour. So clinics potentially see that as making it more attractive to donors, and that might just be because actually they are compensated for their travel in more adequate ways than they used to be. but clinics have got better at kind of advertising, and the compensation, the financial compensation, is always mentioned. So we analyse recruitment materials from clinics across those 3 countries, and it's always mentioned. And it might not be framed as a kind of incentive, but it is always stated that there is a financial compensation, and inevitably that will be a motivation for some people.
Professor Nick Macklon, from the London Women's Clinic, do you advertise and make clear that there's compensation?
Yes, so part of our organisation is the London Egg Bank, which is the largest egg bank in the UK, and it has grown over the years to be able to provide eggs to all the women who need them in order to have their family by advertising. And advertising is very important because although we know that there is a very high level of wish and altruism amongst women to help other women, not many women will be aware of this possibility, particularly perhaps in their 20s, late 20s, early 20s, when they're thinking about other things in life. And therefore, advertising is very important. And although we do get inquiries from women who have not seen any advert, they've maybe spoken to someone, they're just aware of the issue, about 80% of the women who inquire about donation will have seen an advert and have responded to that.
Is it, I mean, you've spoken about women in their late 20s. I wonder, an 18-year-old woman can do this. Is that ethically, does that feel ethically right to you, that someone so young is going to kind of undergo a procedure that could leave them with a biological child?
Well, there's quite a lot in there. They wouldn't leave them with a biological child. What they're doing is they're donating eggs which they would have lost that month anyway, and which would not have become children and will become the child of another couple or another woman. But I understand the point, and it is therefore important that we understand that the women who see these adverts are capable of discerning them, understanding them, but also have the security of knowing, as Nikki said, that they are produced from clinics that operate in one of the most highly regulated environments in the world. In other words, they are able to have the security that knowing that if they respond to that they will be dealt with professionally and carefully in the United Kingdom. So, I think it's important to recognize that some of the donors will be younger. The average age of our donors is 27. And a small proportion, around about 5%, will be under 21. But the advertising that they will see, I think, is clear, is honest. It's not patronizing, but it does make sure that they're informed of this wonderful possibility, to which many of them respond.
Is there, Nikki, any regulation around the kind of advertising? And if not, should there be?
Yeah, this is a bit of a grey area, actually. Excuse me. So it's the advertising for donors that clinics do isn't covered by the HFEA, the licensing body. And although there was a directive put out last year, I think maybe the year before, in relationship to how clinics advertise treatment, which was in conjunction with the Competition and Markets Authority, that doesn't cover the recruitment of donors. So it is a bit of a grey area and a bit of a black hole in terms of regulation. I think yes would be my answer. I think we do need to have a look at how information is given to donors at that initial stage.
Let me read out this advertisement. One advertisement, for example, one says, "Do you want to do something amazing this summer? Become an egg donor. Help someone create a family." Another says, and this is the London Egg Bank, and Nick, this is obviously connected to you. Are you a student and have free time to do something meaningful this summer? Egg donation is a kind and generous act which helps other people create a family. When you donate your eggs, you give a meaningful gift that has the potential to change lives and create families. And by offering you the highest standards of care, there are benefits for you. And you go through genetic screenings, fertility health check, compensation for your time, the reward of a job well done, compensation £750. What was the thinking behind that in terms of how you pitched it?
Well, I'm not an advertising specialist by any means, but as a doctor who sees donors and obviously the patients who rely on the altruism of these donors, I'm very comfortable with that advert. It's not patronizing in any way. It treats these women as educated independent women, which they are.
They're aimed at
In the vast
students.
majority of cases.
They're aimed at
Yes,
students, aren't they? And I know, when I was 18, I don't know if I would have had all the life experience, should I say, to make a decision like that.
I think there are many of the women that we see in that age who will inquire and then will decide not to continue after they've had conversations with us. But those that do it in a very informed way. They are adult women and they are capable of clearly of making these decisions, but they need to be properly informed. And I think that the advert that you've read out, which, as you say, has been written to students to consider doing something very special, which it is, but which is also demanding. I think that explains that to them. What the opportunity might be for them to do something, which we know is so important. I mean, there will be many listeners to your program today with children who would not have them if it hadn't been for the wonderful things that these women have done to donate their eggs.
Indeed.
And I think it would be wrong to exclude that group from this knowledge that this is something that they can do.
Niamh, when you saw these advertisements and you look back now, do you think it was appropriate that students were targeted?
No.
Why?
Personally, I see some of these adverts as quite predatory, because although it was not the intention, you're targeting financially vulnerable people. We all know that students don't get a lot of student finance. Student finance has not risen in many, many years. We're less off financially. So, of course, we're going to be driven by something that's offering us a quick £750 for having a summer free. And, what student doesn't have a summer free? So, of course, students are going to see that and think, oh, yeah, I'll do that. I'll do whatever it asks me to do if I'm going to get a bit of money for it. So I don't agree with them. I don't agree in the way in which they are advertised and the way that, they can pop up on your Instagram feed as you're scrolling, or have you thought about doing this summer? I do think it is very predatory.
Nick?
Yes, I would not agree with that. I mean, it's not predatory in part because, we're operating, as has been said, in a highly regulated environment. The sum of money that's offered, a lot of thought went into that by the HFEA and other authorities as to what would be appropriate to cover and recognise inconvenience, but without being on its own a financial inducement. And that's, I think, reflected, as we've discussed, in the advertising and the information that's out there. And I do think we shouldn't underestimate the ability of women to make decisions and to recognise that donating eggs is something far more than getting a quick cheque for £750. I mean, that is, as we've already agreed, is a very minor element in this. And therefore, to see it both as predatory and, it's not just targeted students. We obviously advertise to all women. And I think is risking being patronising to them. And I think that they will be capable of realising that this is something more than just a fast buck, which is, I think, being implied, but something very, very important with a very profound effect on women who otherwise wouldn't be able to have a family. And I think it's something that, we can celebrate in the UK. Our regulatory environment is very tight and is attracting patients from overseas to come here because they see that the egg donors are being properly cared for within this regulatory environment, which we have to do in order to follow the law.
Nikki, just a brief word, if you would. Just, there will be people listening right now thinking, this is something I'd consider. Is there a word of kind of caution or a word of encouragement you'd like to say? Kind of one of each, I suppose.
Yeah, I think for people considering this, I think getting impartial information is really important. So we worked as part of our research with the Seed Trust, the Sperm, Egg and Embryo Trust in the UK, to produce impartial information, videos of donors talking about their experiences, because one of the things that people told us is that doesn't exist. There's a lot of information on clinic websites, but it's not always in the donor's interest because it is portrayed in a very particular way. But most of the women we spoke to didn't regret egg donation. You know, it wasn't meaningful. Even if they had some mixed experiences, they did find it a meaningful experience on the whole. So I think it's about talking to other egg donors and finding information that's not linked specifically to clinic websites, because obviously clinics are seeking to recruit donors and don't necessarily always present the risks in a very clear way.
It's been fascinating, this conversation. Thank you so much for your time with me. That's Professor Nikki Hudson, medical sociologist and director of de Montfort's Centre for Reproduction Research. Professor Nick Macklon, medical director for the London Women's Clinic. Thank you. And Neve, thank you very much for sharing your experience as a veterinary student who's donated twice. I should say, we were talking about the HFEA, the regulating body. Its response to calls for advertising regulation is as follows. Choosing to donate your eggs is a personal choice, which shouldn't be taken lightly. Donation is a complex decision and one that has implications not only for the donor and recipient, but also any child born as the result of the donation, along with their wider family. For this reason, no patient should donate their eggs, sperm, or embryos without first being offered counselling, which UK licensed clinics are legally required to do. It goes on to say that donors should be comfortable with the fact that children born from their donation can contact them when they turn 18, and clinics have a responsibility to ensure anyone using fertility services understands the risks and long-term impacts of any treatment decisions that they make.